Infection and death rates in many African countries have turned out to be much lower than initially feared, as the number of infections dipped sharply in South Africa, the worst affected. Experts in the region are exploring the various hypotheses and studies. Population density is such a key factor. If you don't have ability to social distance, the virus spreads. But some experts are now posing the question, what if the opposite is also true? What if those same crowded conditions also offer a possible solution to the mystery that has been unresolved for months? Some regional experts say Africa's experience with different types of viruses and experience with population control with diseases has helped. To talk more about this, Dr. Sam Agatre Okuonzi, Arua Regional Referral Hospital head in Uganda, joins us now. A very good evening to you, and thank you so much for speaking to us. Dr. Okuonzi, I know this is something that you have passionately said, that the problem was that Africa is being projected as a center of disease that is incapable of defending itself, deflecting such a pandemic, and that's why people have found themselves flummoxed by what they've seen.
Thank you for having me. Thank you very much. Yes, at the beginning of the epidemic, there was a panic in Africa because it had been projected that Africa would be devastated by this disease. I think this was following from the pattern that had happened in Europe and in America and in China and in other places. And of course, the idea that Africa is usually a country, or they call it a country, a place of disease. Africa is associated with the disease. In the minds of anybody who is outside Africa, Africa is associated with the disease. And so people said, oh, now that this disease has come, Africa will be no more. And they made very outrageous projections. And as we have gone through these 9 months now, Africa is still here. The disease is subdued, and we have done fairly well.
There's been the concern around there's been concern about a lack of testing or not having such a huge capacity to do so. Some people say maybe that's why our figures are low. But you've been involved in the studies of the genome sequencing as well. So you've also been involved in the modeling for the different modeling methods and approaches for this disease. So tell us about the different metrics, how it is that Africa has survived.
The metrics that they have been using actually is a European model. They have used the European population and European metrics to project what Africa would look like under this disease. But now our patterns are just beginning to emerge. And a number of things have begun to appear to be clear. And one of them is that the population, the youthful population of Africa, is something that is protecting us a lot. The youthful population. And the second thing is Africa is largely rural. Of course, there are exceptions. South Africa is a little bit different from the rest of Africa because there are many urban centers. But the rest of Africa is rural and outdoor. People live outside. And that helps us a lot because you don't get much of this transmission, the contagion, in the open air. So that has helped Africa much, much better. The other one is that Africa has not been in much contact with the wider world. There are a few centers which are in constant contact with the rest of the world, but the majority, the bulk of Africa, is really not in touch with what goes on around the world.
Let's talk,
which is different.
Dr. Okuonzi, let's look a little bit more closely at that difference between the northern and southern hemisphere. It's been said that Africa has had its own pandemic, and I want to understand what is meant by that, because we see Europe now largely seeming to experience a second wave, and while the WHO Africa says there has been a mutation of the pandemic here, but it still remains pretty much the same.
That's true. We are still in the first phase, and it is a very low, what we have described here as a smoldering type of epidemic. Low case. It might take longer than what has happened in Europe, and so we are not even thinking of a second wave yet. But of course, what makes up Europe and the other countries different from Africa is that their populations are older, and the coronavirus that causes influenza has been in Europe for many more years than in Africa. And it causes much more frequently, it causes epidemics than in Africa. So it's something that has been happening already in Europe. But this is a new...
The youth factor has been raised, and the question was asked that why are we still not able to arrest at least the pandemic where it is still growing in areas. And I want to talk about, you talk about that the population is older in Europe, but we have a younger population. So then if one is to follow the logic, then shouldn't we then have a high infection rate? And how much does the weather have a role to play?
It's not fully known how much the weather has made a contribution. Studies are still going on and patterns are being assessed, because some of the weather factors do not the trend we observe. For example, Brazil is not very different from Africa, but of course it has a very full-blown epidemic compared to what is happening in Africa. So the climate factor may make a contribution, but not full. What seems to be driving it is really the population, the indoor culture of the indoor culture of the people in Europe, and the fact that they were less prepared in terms of responding to the epidemic.
Right.
In Africa here, we have had many epidemics, and the recent one being the one of Ebola, and before that it was Marburg, and many other epidemics that have happened in Africa. And people are very sensitive to such emergencies. And so when the COVID came, it was very easy for people to mobilize and to respond compared to other countries in Europe, for example.
Wish I had more time, but thank you so much for your perspectives, Dr. Sam Agatre Okuonzi, who's the head at Arua Regional Referral Hospital in Uganda. He's also been involved with the WHO Africa Regional Genome Studies. Thank you very much.